The most important part of making a diagnosis is to go to somebody who's knowledgeable about MS, who knows how to take a really good history, looking for past problems, because MS is a disease that comes and goes, and so most of the people who come into the office have had past problems, so taking the history is very important. And then doing a very thorough neurologic examination. So the history and the examination are very important. The next step is the MRI. And the MRI is added just tremendously to our ability to diagnose MS early. You say, well, who cares? Well, I care, the patients care, because if you diagnose early, you get treated earlier, and we know these drugs work better when you're treated early, so it's been a tremendous help. Patients that we're struggling with, we'll do a spinal tap. And the spinal tap can be, show abnormalities that look like MS. We can actually measure with a computer how fast an impulse gets from the eye to the brain or to the ear to the brain. They're called evoked potentials, and they sometimes can be helpful. But the major part of this is making sure they don't have something else. No better explanation. And so there's a list of 30 or 40 diseases that can mimic multiple sclerosis. And so our job is to say, this looks like multiple sclerosis, I think this is multiple sclerosis, but could it be something else?